Hey everybody, welcome to another Conversations in Cases, and we are super, super excited today because our conversation is with our good buddy, Kim Kovacich.
Yes.
Our case today is going to be on immunity, which is very interesting, especially at this time of year. And so, yeah, Kim, this is your 1 year anniversary.
Today, right?
It is, yes.
Working with us here.
Yes.
You have had to work with me for a year, and I mean, that in itself is something special.
I'm doing my best. Frankly, you guys both make it super easy to work with you. I mean, it's like being home. I really feel part of this practice.
And I think one of the things, I don't know that anyone probably knows when they come in here, but we started our wellness center back in 2007. It's been a minute, right?
Yeah, the yoga.
And I remember I was kind of the general contractor at the time, helping to build out, the space. And we were still under construction, and here comes in this cute little person, and she goes, "What are you guys doing in here?" And it was you, Kim. You were
Yes,
like,
it
"Well,"
was.
well,
Our
you're
very
yoga
first
place. She's
client.
like, "Oh my God, I love yoga." And so, yeah, you've been in our life since then.
Yes.
It's been a long time.
It's been a long time, and over the years, our paths kept crossing. I mean, we had yoga that we were doing together, and then
Yeah, you graduated the 200 and the 500-hour yoga teacher
I
training
did,
program,
which is amazing.
which is 500 hours
yeah,
of training.
Exactly.
it's a lot.
Well, and then with the medical community, we kept kind of running
That's right.
past each other, and
Yeah.
a couple of our kids went to Garrett
Classes
Catholic together.
and all that
So,
stuff.
Yeah,
so
true.
it was kind of in the cards that we all ended up together.
But as a nurse
you're right.
practitioner, you've been practicing for a good number of years.
Yes, I've been an NP for 27
What
years.
does an NP mean? I don't know that everybody
Wow.
understands exactly what that is.
Well, sure. I got my undergrad in nursing in 1991, and then I went back to grad school and got my master's degree in 1997. So an NP can see patients, do physical exams, order and interpret tests, lab tests, imaging, diagnose, treat, and prescribe medications.
Yeah,
So we really have
it's a lot.
full scope of things we can do.
Yeah. I mean, it's such a help in this office. Of course, I think most of the patients that are on board recognize that when they come in, this is a different practice.
It is.
Our main focus, our main vision is holistic primary care, right? And it is a focus on prevention, optimal living, which is a little different, I think, than what you get in a lot of offices. And the ability to have a team that is, unique. I think we are definitely unique.
Yes.
To provide that care has been very fulfilling for all of our patients.
And for us.
And for us, exactly.
Right? Yeah,
Yes.
I know.
Yep.
Well, and before this, you can tell a little bit more about it. I know you did rheumatology, you've done family medicine, you've done OB, right? I mean,
It's some gynecology.
Gynecology,
Yes,
God,
yes.
yeah.
So when I graduated nursing school, I worked in the surgical ICU at University Hospital downtown.
Well, that's high energy.
It was so much fun, and I learned so much. And then when I finished grad school, I worked in the rheumatology office for 14 years, and that was invaluable experience and such a nice practice. After that, I did some primary care and did a little bit of gynecology after that, and now I'm here.
Yeah, which is awesome because you get to use all of that every day.
I do.
Seeing our patients, whether it's tapping a knee joint or seeing someone for a physical or a PAP or doing infusions. I mean, it's been amazing to see what you've brought for us here to this practice. So,
And so
We've
I
loved
think
it.
some of the patients maybe don't know, but I mean, you are a big help with the sports physicals, some of the wellness, the acute care.
Yes.
Is a big piece of what you do here, and obviously you have been helping. I think a lot of times people might think of you as the one that might do their infusion,
Which I do.
but you do a lot more than just that.
Yes.
here. And that really is the focus. If we're to care for our patients, that it has to be a big focus on this prevention model, which you are amazing at, right? And then also our care on a day-by-day basis.
Yes.
So we offer this amazing, I think, breadth and depth of care with three. It's not even a handful. We're just at three
Here?
We're not a handful of people. There's only 3 of us.
Oh, no.
Yes.
There's not 2 more people here. That would be a
No,
handful.
we are the staff.
Yeah. With
We're
the
set.
front office and the back office.
We are. We wear many hats around
Yes,
here,
we
don't
do.
we? Which is
Well,
fun.
I appreciate the variety of patients that I get to see, and I get to, have different touches with everybody, and from infusions to seeing patients for acute needs or new patient visits or physicals or whatever. So I appreciate the flexibility that I get here.
Yeah. Oh no, you've been a big addition.
Well, I think too, when we started this, and just the fact that we implement these 4 pillars, right? And we've always said, like, the breathe pillar is our, our foundation and our base, and having you here, because you live this too, and you get the yoga and this whole philosophy. And I think when people walk through the door, it's a different air, it's a different welcome, it's a different environment in a good way that we're here, because you know what, that's part of the healing. I feel like just the way that we're present here, it's not a scary place to come. It's just sitting here talking with us and being here, or coming to a meditation at noon, or coming to a yoga class. We implement this into health and wellness, and so it's so perfect that this worked out and our paths crossed and we got to do this together.
It's by no mistake.
It's definitely been no mistake.
We know that to be true.
I think we jokingly would think, like, it'd be so cool to work together, and then it just it fell into place.
Yeah, it just happened.
It's amazing.
It was perfect timing for all of us, I think.
So it's wonderful. And I think, as we are growing this practice and in a phase of life where hormones and perimenopause and menopause are pertinent for us and our patients, that's something that both of us are really growing out for our patients, and to try to really be there to help them through this aging process, because that's part of optimal aging and wellness. So
Yes, we don't
I know
like to
we're
age
both
gracefully.
and so that's a big focus for both of us,
Exactly.
and I think especially you are going to be kind of the leader in that for this office, which I appreciate.
Earlier, and they're in their 60s, and they're like, Eric, it's just all my friends, same age, we're having these gut issues, or we're having these things are getting more complicated, right? And there's just not a lot of care teams out there that will say, okay, let's dive in and figure out what is going on. I mean, many times it's like, okay, well, you just need to take this or just take that. And that's about all they have time to do, which is what it is.
Right.
But I think what we see is that people should be afforded the opportunity of care that gets down to that highest level of knowing as to what is really going on with an individual, instead of just saying, because like you were saying, okay, yeah, like I was like thinking I had acid reflux, when actually what I had was low acidity, right? So, I mean, it's things like that we can get more objective with people to help them to get their body back into balance. In the absence of that, we're treating something and causing it to stay out of balance.
Well, and we have time. I think all of us,
Yes.
it's nice. They get a lot of touches with all 3 of us, and we have time to listen and try this, or maybe, oh, that didn't work. We got to go a new direction, or let's step back and think, and let's reevaluate this, or let's research and investigate things. And that's been, I think, the biggest plus for me just with this model is time. And that, if you can just stop and listen and take time, we learn so much from our patients.
We do.
So I think that's been huge. But you're right, our body, and we've done, this isn't really the case, but we've done a lot over the year together with our weight loss program, and whether it's the infusions or the injections, and we kind of did a podcast earlier on that, but that has been, and you've really been integral in that, and just really meeting with patients, guiding them and helping them on that journey. So I know that's been huge. But today I really wanted to focus
Are we
on
getting
a
into the
new
case?
topic with immunity.
It's a good time for that. Coming into the fall,
Yes.
we're seeing more people get sick.
Yep. And I have 3 women at different phases of life. One is in their 20s, one's 40s, and one's mid to late 50s. And they all were dealing with immune issues like infections, recurrent infections, in different manners. The first is actually Lucy, our daughter. So I told her I was going to use her name. So, but, backing up, so Lucy, and she's a healthy kid, not a lot of medical problems, but when it was the pandemic hit, and in August, she got COVID, and she got it in December. She was my first patient and the first person, even in our practice when I was at my old practice, like that any of us had seen like get COVID twice in 4 months. We were like, what is this? And then she would easily get flu and like get really sick with flu every winter. And so as time went on, it's like, okay, we've got to do something, like get back to the root cause, right? Not just kind of keep patching and stuff like, okay, why is your immune system off? And so we really did a lot of focus on gut health with her and diet. She really got into, we did some food sensitivity testing, and dairy showed up really high, milk, and so she got rid of milk. And we started doing the infusions because we started those just like right before you came, and then we really built it out. And so we did the immunity, the tri-immune with her, and it was crazy. Like she moved in, she was in a house with a lot of young women in the sorority, and everybody around her was sick, and she didn't get sick. And then she always gets the flu. It seems like she would get really sick. No flu last year. And we did these, I think, like quarterly or every few months for infusions. Yeah. And then, and even this fall, like she got a little cold recently, but it's just been the past year and a half. I'm like, that's crazy to see the changes in her immune system. And we've also had, I know you've seen some women that we're doing monthly. I'm thinking of one, like she, again, every time her kid would get sick, she'd get sick. And then she'd end up on an antibiotic, and that wipes out your gut. And then you're like chasing the whole, And once we did a little boosting up with the glutathione, the vitamin C, all of those are like our natural antioxidants that help our immune system just be capable of managing if a virus or something gets in our system, and zinc. I think she did amazingly well. And then we had another one that has some autoimmune, which with your history and your rheumatology experience, she's had Lyme disease, she's had some other autoimmune issues, and then COVID 2 or 3 times. And I think that was a huge help. Don't you agree with her getting over the hump?
It was interesting to see how she did after a series of infusions and just how she said she felt and how she looked.
Yeah,
you could see it.
Yes, absolutely.
And sometimes they're every couple of weeks, or sometimes they're, like we said, every few months. But I think us testing and all of that really helps. But I do think just being aware as we're entering into this fall and winter season that there's so much we can do for our immune system, and that's eating a healthy, clean diet, lower sugar, lots of the antioxidants and fruits and vegetables, and healthy proteins, healthy fats, working on your gut health, really focusing on that, and then considering some like either testing to check immune system, or not immune system, nutrients, micronutrients, testing food sensitivities, those type of things can really help people.
Yeah. And our members have the priority of the appointment, but we do, if we have openings, we do allow non-members to get infusions as well. So for those that are wondering.
Well, we're so grateful for you, and happy 1-year anniversary to all of us.
Yeah, thanks for being here.
I'm grateful for the opportunity, and this is home. Thank you. It's wonderful.
Well, we are wishing everyone a wonderful day. Take care.